Most patients with migraine don't actually present to neurologists, let alone headache specialists. 1 out of 10 visits to primary care are actually for headache. So, this is a really important special interest group to serve as liaisons to primary care providers across the country. Our mission is to enhance the educational, patient care, and research activities of the American Headache Society in the field of primary care. Importantly, we collaborate with other special interest groups to ensure that headache education, programming, and research involves headache care in the primary care setting. For example, we work with the underserved, women's health, and pediatric special interest groups. So the American Headache Society has developed a first contact headache and primary care advisory board. The group has developed educational content for presentations at institutions throughout the country. This includes grand rounds presentations, a website with educational resources and podcasts. And members of our special interest group have been excited to work with the advisory board and have volunteered to put their institutions or neighboring institutions in contact with the American Headache Society. They volunteered to serve as grand round speakers and to write educational content for the website. So in addition, with the increased use of telemedicine across the country, our special interest group decided to take an active role in surveying members of the American Headache Society to understand headache providers' interest in and comfort with the use of telemedicine in diagnosing and managing both primary and secondary headache disorders. There have been some recent publications on the role of teleheadache in the past few years, but never before has it been used so widely. So we actively enjoy collaborating with various special interest groups, and this telemedicine survey or teleheadache survey is in partnership with the American Headache Society Clinical Informatics Special Interest Group. We have a lot of goals for our special interest section. The first one is to generate interest in trainees in headache medicine, to make sure that internal medicine, family medicine, pediatric residents know that they can also become headache specialists, not just those in neurology. Also to continue to collaborate and share expertise with the American Headache Society First Contact Primary Care Advisory Board. Also to continue to offer headache education sessions at primary care oriented conferences throughout the country, as we've been doing so for a number of years. And then also to continue to work with the other special interest groups to ensure that the important work that they do is disseminated and implemented at the primary care level, since that's where so many of the patients with headache present for care.